Good evening, folks. It's Diamond with the Oppenheimer Ranch Project and Magnetic Reversal News, bringing you a COVID-19 update on Memorial Day evening around 10 p.m. Mountain Time 2020. And tonight we're going to unravel the facts versus the fiction, the fear versus the reality. And we start tonight at Wu Flu Live, where many of you have been following since March, even February, the numbers as they rapidly increased. Now, I want to go over these numbers quickly with you because they mean nothing. This purple line simply represents the number of tests given daily because they've remained the same. And this plateau is the amount of testing capability that we have had. And it has not increased, barely. In fact, it hasn't increased at all. Some testing sites, almost no one is showing up. So this has nothing to do with an actual statistic. Another thing that has nothing to do with an actual statistic is this death rate, 6.3%. It started around 4%, but it's gradually risen. Why do you think that is? Because they are not testing the public. There's a limited number of tests, and that gives you a high death rate. But keep that in the back of your mind as we go forward. And let's talk about the global incidence of influenza real quick. We're over here at Medscape. The World Health Organization estimates that worldwide annual influenza epidemics result in 3 to 5 million cases of severe illness and up to 500,000 deaths annually. 3 to 5 million cases and 500,000 deaths annually. Well, that's basically the numbers we have right now from this pandemic. So they kept within their realms of their own numbers. That should be very telling. This is right in the social norm of the official recorded numbers. Now, let's get to some real numbers. Does this work any better? Nah. Let's keep that on. The CDC's new best estimate just coming out implies COVID-19 infection fatality below 0.3%. That's the same as the flu. It's approaching the flu numbers. The rate is much lower than the numbers used in the horrifying projections that shaped the government response and the shutdown of this pandemic. And this was planned from the beginning. If you give the false data, you get the false numbers, you get the false scientists to give you the false predictions, and you could do basically whatever you want. But now that we have the facts, we have enough data set to actually come up with the numbers, and we're going to go over this in great detail in just about 10 minutes. So stick with us. We're going to go over the scientific inquiries into the actual death rate and how they arrived at these numbers, which, by the way, continue to go down. So the more people that get tested, the more antivirus tests, the more testing, down, down, down. Death rate goes from 6% now at 0.3%. Do you see this death rate currently being touted by the CDC at 0.3? Let's come over and look at the Wu flu numbers. 6.3. That's almost illegal. That is, I don't know if I'm going to tell you how many times magnitude above 0.3%, 6.3% is, because it's illegal. This is propaganda. This site, Wu Flu Live, everyone that's given $1 or bought him a cup of coffee should demand a refund immediately. In fact, we should take this idiot to court. This is fake news. This is fake science. This site means nothing. Same as the GIS, the Johns Hopkins site, and Worldometers. Those sites simply gather available data and regurgitate it. And there is not enough available data to give you the facts. But there is. And we're going to show you some scientific papers that have available data that go completely against this nonsense that's showing up here on the screen. It's insane. The CDC estimates that 35% of coronavirus patients don't even have symptoms. Now, if they've been off by a factor of 20, could there even be 350% of patients that are asymptomatic? No, but 20 times that number brings it to like 70, 80% in reality. So what's going on? Well, let's listen to what the article says. According to the CDC, the current best estimate for fatality rate among Americans with COVID-19. Now, granted, America has one of the highest death rates according to the numbers. How do we do that? According to the CDC, the best estimate for fatality in Americans is 0.4%. And they shut down the economy for something similar to the flu, which happens every year. So someone is going to be held accountable for this simply based on this reveal. It's a reveal. You're slowly being revealed the facts, so you don't get too bunched up. But you're also fearful and wearing your mask in the public, and you're so hypoxic that you probably haven't been able to think much for 3 months. So the current death rate in the U.S. is 0.4%, and those numbers imply, if you add in this idea that 35%, according to the CDC, are asymptomatic, if you add that in, less than 0.3% of people infected by it so far have died. 0.3%, according to the CDC, and they're liars. So can you imagine how low that number actually is? I can't yet, but in a few months I will know. Now, the CDC offers new estimates in its COVID-19 pandemic planning scenarios, but I guarantee if you come over here and you read this, you're not going to be able to figure a thing out. And that's on purpose because they're trying to disinform, scare you into complacency. They want you to wear the mask and stand in a line 6 feet apart and be scared and get the vaccine ID and all that nonsense that they thought was going to roll out without any pushback. Well, we've pushed back from the beginning. And the numbers that are coming in are farcical. So every country in the entire world tanked their government on purpose based on false information from leading scientists. The same thing that was about to happen with climate change. And yet channels like ours and producing information like this are being censored, shut down, and demonetized because we have critical thinking and we use scientific basis for our analysis, where we don't conclude anything based unless we have observational data to look at. And that's how we change our hypothesis as it moves. And we call that scientific rigor. It's also the scientific method, by the way. Anyone else that's not using the scientific method is not a scientist, which basically is 80 to 90% of all current mainstream scientists. They're not scientists. They are adjusting their data to meet political protocol to get funding so that they can feed you sharp information. And that's what happened during this pandemic. They got the right people to give the false information to unroll the plan that they had already setting in place. And now the reality and the data is coming to fruition so that we can share it with the public, so that you can make your own informed, critical decision. You can make your own conclusions about what's going on. Now, a lot of you are just coming into this data, which is pretty normal, but I'm going to tell you what the CDC is now saying, which has been wrong the whole time. So now what they're saying now, are you going to buy it? But let me just tell you, it's going down and down and down and down into the dirt, which means that many people have to be held accountable. In fact, if we do not remove every single person in power that caused this pandemic, the shutdown of small business, 40% unemployment, and wait till you see what happens in the next 6 months to a year, if not the next 3 years. There are going to be tens of millions of people starving to death around the globe because of this false flag, period. Now, according to the CDC's 5 scenarios, none of them came true. And if you want to know the facts, we're going to get to them real quick here. The most important factor here. The most important factor is the percentage of infections among people with serious pre-existing medical conditions who are especially likely to die from COVID-19. Now, the majority of deaths in most of the hard-hit European countries happen in nursing homes. And I'm sure you're aware of this. And then American governors like Governor Cuomo put in place the same protocols they did in Italy, which killed most of the people there. And a large proportion of the deaths in the US also seem to follow the pattern. Locations with high burdens of nursing home deaths may have IFR estimates, and that's because we put sick people into nursing homes where the people the most at risk lived. This is absolutely disgusting, and Governor Cuomo should be held accountable for tens of thousands of deaths in his state. At least half the deaths in his state was because of improper protocol. On his watch, he mandated that sick people get sent into nursing homes where the most vulnerable subset of humans existed. Now, 80% of the population that died from this disease are people with comorbidity in nursing homes or comorbidity that should be in nursing homes and are at home. And so from the rip, we should have known, based on all pandemic data and all infectious disease, that the elderly are most at risk. Those with comorbidities are most at risk. Yet the CDC itself and every other agency did not know that this was the data. Or did they? They clearly had to know because they're the ones creating this information. If it wasn't for the CDC, we would not know the comorbidity data and the fact that elderly are the most at risk. Yet they could care less because they were unrolling a plan that was initiated by the Bilderbergs, the elites, the Bill Gateses, and the multinational corporations that control Europe. But I digress because I am not part of that plan. I opted out 5-6 years ago now. And the reason I opted out is becoming ever clearer. Now, the factor in one plausible explanation for the big difference between New York and Florida, is that they didn't put sick people into old age homes in Florida, probably. But let's get on with the podcast, or this will go on all day. So the CDC has gone from millions of deaths to hundreds of thousands to 100,000. And the death rate has gone from 6%, 6.3% to 0.3%. As we sit locked down, the whole economy tanks. Yeah. Your retirement is missing, and it will be missing by the end of the year. Trust me. As we head into this election, you're going to be decapitated financially. Inflation will ensue. Fake meat will flood the market. No one will buy it, and they're going to throw it out. And those companies will tank, thankfully. But those fat pricks like Al Gore that are part of this pandemic, trust me, they will fall. Because the population is waking up. And now scientists say new lower CDC estimates of COVID-19 severity are optimistic. And you know what just happened? Hundreds of millions of people flocked to beaches in close proximity. And you guess what's not going to happen in 2 months? Millions of deaths and hospitals packed. That will not happen. Because during the initial outbreak, it didn't happen. We wasted tens of millions, if not billions of dollars on fake hospitals. And now we're manufacturing hundreds of millions of ventilators for a pandemic that will never occur, albeit may occur because they're waiting to unleash the next virus that they created in the lab, which is even more virulent. They were like, wait a minute, we might have dropped the ball on this one. It's equalizing. It didn't do what we said it would do. It didn't scare you enough. Yeah, because it's just like every other disease. It neutralizes itself. Let's get to the scientific facts. This is the paper that everyone's gone into a tizzy about. And I guarantee that you'll never hear this on NPR or any of the other multinational corporation pipe holes. Maybe Fox News. That's our only hope. But the infection fatality rate of COVID-19 inferred from seroprevalence data. Now, for those that have no idea what I just said, seroprevalence in layman's terms is the number of people in a population who test positive for a specific disease. So that means how many people have it. That's seroprevalence. Now let's read the entire abstract because I think your mind will be blown. Objective to estimate the infection fatality rate of coronavirus disease 2019 COVID-19 from the data of seroprevalence studies. This is from the general population of those that are infected. Methods, population studies with sample size of at least 500 and published as peer-reviewed papers or reprints as of May 12th. So they've taken all of the scientific literature up to May 12th. This is current, folks, as current as you can get. Now, studies on the blood donors were included, but studies on healthcare workers were excluded because they have a high risk of virulence because they're constantly breathing the COVID. So they took those out. Now, the studies were addressed for design features and seroprevalence estimates. So they really honed in on this with a good data set. Infection fatality rate was estimated from each study, dividing the number of COVID-19 deaths at a relevant time point by the number of estimated people infected at each relevant region. That's the way you get an actual death rate. You take the number of deaths versus the number of actually infected, and that's the death rate. It's like simple math, but no one has provided us these answers until today. Now, correction was also attempted, accounting for types of antibodies addressed. 12 studies were identified with usable data entered into the calculations. Seroprevalence estimates, this is the estimate of those infected, ranged from 0.1% of the population to 26% of the world. Did you just hear that? The range of infection in the world is either 0.1% to 26% currently infected. Now, an adjusted seroprevalence estimated, this is the adjusted data, says that either 0.3% of the population is infected or 33%. That's a huge amount. If a third of the world has already gotten this disease, this is the farce of the century because we're already immune, 1/3 of us. And it's over. Now let's get to the death toll. It's even more embarrassing based on, well, the whole layout of this pandemic is embarrassing. The number one guy that shut down the world, he was like banging some married chick in Europe and over in the UK, and he was sneaking her in during lockdown, and he was the one that locked the whole country down, saying that 2 million would die in the US. That guy's got to be in hiding for the rest of his life. He probably lost all of his friends, and any of his friends that stuck with him anyway are superficial schmucks that we don't care about anyway, and they're all pretending to exist in their own little bubble. Hello. Oh, did you read that new book? Yes, I take the whole world and cause billions of people to die of starvation, but no one cares because I'm amazing. Yes, I'm Niles Ferguson or whatever my name is. I divorced my wife and bang a married woman. Yes, I'm a complete amazing example of humanity. Have you seen my bank account? But I digress. Now, let's get to the death rate. This is crazy. Infection fatality rates range from 0.03. That's 0.03%. That's like Zika, or that's like falling down the stairs. That's like getting hit by a bus. So COVID-19's death rate is like getting hit by a bus. So everyone's like, no, it's totally serious. Patrick Ewing got it. Well, Patrick Ewing could have got hit by a bus because he was texting, because he's fat and tall and overweight and made millions of dollars playing basketball, and he stopped exercising. Duh. I mean, give me a break. The auto-corrected values bring it down to 0.02%. That's the low, 0.02%. That means you have a higher likelihood of getting hit by lightning or riding a bike than COVID-19. Are we going to stop riding bikes? Are we going to stop getting hit by lightning? Can't we just tax the lightning out of our existence? Probably not. But many people think we can. Those are the sheep. And unfortunately, that's 80% of the population. 80% of the population think we can control the climate with taxation. And they may even think we can control lightning or buses from killing people with taxation. That is how insane and brainwashed the world has become. It's almost egregious. But I'm in a bubble. I've been locked away, opting out of society for 6 years. And for good reason. The world has lost its mind. Society has been led astray. Bah! Now, with a maximum death rate of 0.4%, it's twice as deadly as the flu, but that's the maximum. According to the corrected values of infection fatality rates, it could be as low as 0.02. And day by day, week by week, month by month, more data comes in and these numbers get lower and lower. When will the civil war begin? When will the population fight back of what has become? What has been done by these groups, the CDC, your government? They did this to you. It's their fault, not yours. This has nothing to do with COVID-19. And wait till you see the flip-flop that Cuomo did today. He has said pandemic, pandemic 1,000 times. I need 100,000 ventilators tomorrow. And he never used more than 1,300 ever. These are the schmucks that we elected to rule us. And he doesn't even use the word pandemic today because he killed 50,000 old people in his state by putting them into old age homes. This is how much of an idiot he is. And Governor Cuomo knows he is going to hell on the Hell Express.
COVID recovery. In New York, Governor Andrew Cuomo honored healthcare workers who came to work and made the ultimate sacrifice.
We're going to make sure that every government in the state of New York provides death benefits to those public heroes who died from COVID-19 during this emergency.
Many main streets
during this emergency. It's not even a pandemic. And you know what, Cuomo? You killed them because of your improper protocol, your lackadaisical attitude, and you don't have critical thinking. You're so stupid. You looked right at the data and you said, yeah, that looks reasonable. I'm not a scientist. I'm just an elected official. And I'm trying to retire. Where's my boat? Where's my pension? So now he's paying off all the people he killed. You want to hear it again? Where he doesn't say pandemic and he pays off the people he killed? Let's just listen to that. It's very telling.
The government in the state of New York provides death benefits to those public heroes who died from COVID-19 during this emergency.
They died from this public emergency because of your protocol, Cuomo. I hope you sleep well. We have more amazing footage coming for you tonight. This is the current Karen in Central Park. Now, a Karen is a woman between, let's say, 30 and 50 that knows everything. Typically a Democrat, has a mask on, but doesn't follow any other rules. In fact, in Central Park, you can never unleash your dog. But most environmentalists and Democrats unleash their dog because they don't follow rules. Because the rules they follow are mandated by idiots that don't follow science, but claim that they know it. Now, watch this woman. So let me give you the background. A young urban professional black man, photographer, bird watcher, is in the park trying to watch birds. And this woman has her little yippy dog running around, bothering him, and it's illegal. And he says, ma'am, can you please put your dog on a leash? You're not allowed to have your dog off the leash. And then she goes all Karen on him. And she says, oh my God, I'm going to call 911. There's a black man who's accosting me. I'm going to be raped by this black man. Well, it's probably what she wants. And the whole time she's choking her dog. I wish PETA would pick up on this. She's abusing the animal and abusing another citizen and making false accusations when all he was trying to do was make a citizen's arrest on a Karen who had her dog unleashed in Central Park, which is illegal during a pandemic, which could make it even worse. that could prevent social distancing and everything else Karen wants. But just watch this unfurl and your mind will be blown. Now, she has since gotten millions of angry responses on her Twitter and Facebook account, and they're all missing. I wonder why, Karen.
I'm asking you to stop.
Please don't come close to me.
Sir, I'm asking you to stop recording me.
Please don't come close to me.
Please take your phone off.
Please don't come close to
And
me.
I'm taking a picture and calling the cops.
Please call the cops. Please call the cops.
I'm going to tell them there's an African American man threatening my life.
Please tell them whatever you like.
So she goes for the African American man threatening her life, which he never did. He said, "Ma'am, could you please put your dog on the leash?" And she just went all Karen on him. Now, this completely gentle, giant, black dude, probably the nicest guy on earth, all he wanted her to do was put her dog on the leash. She doesn't do it. The whole time she calls 911 and lies to the police, which is a felony, and they don't take her in for it because she's white. Had he made the call, he would have been taken in for lying or whatever. But this Karen over here, she's going to call the police and lie directly to them, and there's no repercussions. And the moment that she puts the dog on a leash, he thanks her and walks away. Let's watch it finish.
Excuse me? Excuse me?
Look at her choking her dog to death. I mean, it's insane.
I'm sorry, I'm in the Ramble, and there is a man, African American, he has a bicycle helmet. He is recording me and threatening me and my dog. There is an African American man, I am in Central Park. He is recording me and threatening myself and my dog.
Bitch, you're choking your dog and you're lying about a black guy that's trying to tell you to put your dog on a leash and comply with the law. This woman should be locked up. She should definitely be bitch slapped. I wish I was there just for the... Ow! Not only that, where's PETA? She's choking her dog. She should be charged with animal cruelty. That dog should be taken away from this woman. God knows what she does to the dog at home. Let alone when a bird watcher asks her to put her dog on a leash. Oh my goodness. This woman is a member of the sheeple. This is what we've created. Completely insane, nonsensical Karens all over the world.
I'm sorry, I can't.
I'm sorry, I can't breathe. There is a black man telling me to put my dog on a leash. I need to choke my dog to death.
I'm sorry,
to lie to you.
I'm being threatened by a man in the Ramble. Please send the cops immediately. I'm in Central Park.
I mean, she got an Emmy there.
The Ramble. I don't know.
Thank you.
Did you hear how I just said thank you when she put the dog on the leash? That was brilliant. And the cops let this Karen away, unfortunately. But I guarantee the rest of her life will never be the same because she had to delete her Twitter and her Instagram and so on and so forth. And this is just the beginning of what's happening. Now, this is in my neck of the woods, King Soopers, where I shop, and these people have been working hard throughout the entire pandemic. They have never stopped. They never had a shortage of workers. They kept going, even though the media was saying we're all going to die and this is highly infectious and everyone's going to drop dead, but no one did. And they got paid extra, thankfully, for the nonsense. But this guy, this is one of the real COVID cases, because COVID-19 is just like the flu. It's deadly to people with comorbidity that are older. And this guy had COPD and other diseases, and he's older. He's in his 70s, and he worked like 50 years as a bagger and a checker. And he spent 41 days in the hospital in Aurora, where we haven't used a single respirator ever. There's less than 200 patients 400 patients in the whole state. We have 1,000 hospitals maybe in Colorado. and less than 400 COVID-19 patients in the hospital. But these pricks in Aurora wouldn't give this guy a respirator, and he died. This is some of the improper protocol. Not only do you send sick people where sick people are to kill all them, but you deny sick people something that may save them. It's complete shit show. COVID-19 is a shit show of government ineptitude. And if you don't pick this up, well, then you'll never put it down. You're a sheep. You're going to take the vax. You're going to be transhuman and have the chip in your brain, and you're going to continue to drink the Kool-Aid. But I refuse. But I will tell you the facts. So everyone in the store cried when they found out this guy died because he's been bagging their groceries for their entire fucking lives. But the family of the sick patient were never allowed to see him for weeks. They requested multiple times he be put on a ventilator. And when they say because of his age and COPD, comorbidity, they would not put him on a ventilator because that's the protocol. Sherry said, adding, they are just going to make him comfortable. That's what they told her. But she was not allowed to go in and fight this. That's called second-degree murder, in my opinion. Manslaughter if you want to be weak. But they had access to ventilators, and they did not use the Hippocratic Oath and try to keep this guy alive because of the COVID-19 CDC protocol, which has now been downgraded by 1,000-fold. People need to be held accountable for murdering your grandfather. And this is one of those cases. Not to mention that out of that 100,000 death count that it's approaching in the U.S., 50,000 were killed by governors like Andrew Cuomo by putting sick people in houses where other vulnerable people were. Over 70% of all the deaths in the U.S. are in nursing homes. Over 85% of the deaths in Europe, nursing homes. Are you picking this up? I just put it down. And I will not take back the facts because they stand firm forever from the beginning. Now, this is the statement coming out from the hospital that killed this awesome dude. We offer our deepest sympathy to the patient and his family. We could have put him on a ventilator, but we didn't because a piece of paper said we didn't have to. As the most experienced hospital in the state of Colorado handling COVID-19, we were not overwhelmed. We had thousands of beds, and yet we did not give your father the protocols that we had in place that could have saved him because it's COVID-19. We were saving that for the rush of patients that will never come, period. And that's their statement. It's disgusting. I suggest you never go to a hospital, and I never will unless I'm unconscious and they take me there in an ambulance. I will die at home amongst my farm and my family, no matter what happens. If I can't cure it, I know a doctor won't. Period. And that's the facts. Hope you got something out of the video. We've been lied to from the beginning. The flu, looking pretty much the same as the COVID-19. The only difference is that as days go on, COVID-19 is looking maybe even more survivable than the flu in the long term. Because it's a novel virus and it's the first time through, we're going to expect more deaths, maybe like the Hong Kong flu or another novel flu virus. This is a novel coronavirus. And I believe that the numbers are twice as inflated because of improper protocols and governors that killed most of the people in our country. They did the same in Europe, and we've proven that, and they did the same in the U.S., and I hope I put up a good case to prove that as well. Governors like Cuomo need to be held accountable. Did you hear about what Governor Whitmer did? She mandated that no one could travel, and then when she opened up, she said, don't rush to Traverse City. And at the same day, she and her family were rushing to Traverse City. These oligarchs are oxymoronic. They tell you to do one thing, and then they do the exact opposite. Just like Al Gore. Remember? We need to cut our blah, blah, blah and greenhouse gases and reduce our footprint. And then we found out his electric bill was $38,000. This is not new. This is like a regurgitated, recapitulating nightmare that was spoken about by Aldous Huxley and many others. You are living in the dystopia that was described 4 and 5 decades ago, 7 in many cases. A brave new world where the brainwashing is so complete that you have to compete with sheep. Bah! Get out of Dodge. Do it now. Proper prior planning prevents piss poor performance when the powers that be don't even understand what science is. And that's a boom. Share this with like-minded people. Subscribe to the channel if you haven't. And go outside. Don't wear a mask. Don't social distance. Go to a restaurant. The world opens up on Wednesday, where I live, on May 27th. And I'm making a reservation at my favorite restaurant. I might even cough. Who knows?